doctors?
Doctors to patients.
Okay.
Not every patient needs to. One thing that's common with clinics and hospitals is long lines outside. People that have come to see the doctor, right? Again, being hyper observative, you kind of see the pattern that not everybody needs to. Like one gentleman is just here because his BP meds are finished. He's been taking this medication for the last 5-10 years. He just needs this prescription so he can go get his meds at the pharmacy.
Yeah.
But he has to sit in line for 6 hours.
For somebody who's getting their foot stitched.
You see what I mean? So you need to kind of break those down. And my thing is, let's almost adopt. It's hard to convince people because you see it in your head, right?
Okay. So paint a picture for me, because I think I've heard about it in passing, but like what would it
I started doing it.
Oh, okay.
Right? Primarily in the sense that you could have access to me.
Okay.
Like you'd be like, for example, do you know Genpain and Myprodol?
I'm over 30. I know them.
They look the same.
Yeah.
Right? This the green and red.
Yes.
If I put both of them here, even to the most trained eye, they won't be able to tell you. It's the same thing, same ingredients, just different brands, right? So I write you something down and you go to the pharmacy and the pharmacy gives you this and says, no, it's the same thing.
Yeah.
And patients are very like,
no, but I want Panado.
Brand oriented.
Yeah.
Like the ingredients is there, like the Panado's inside. But you're like, no, now I want Genpain. Like, no, but Myprodol's, I want Genpain. You now have to go back
to the doctor
in line to be, I went and they gave me this. Is it okay? So you start with those conversations. Or my son fell and hit his head. What should we do?
This is a full-blown consultation when I come in and fill in forms and then wait.
And I can tell you, listen, no, rush straight to the ER. Don't even bother going to the clinic because it's not something that we can do for you. But essentially try and have the doctor available even remotely is what I'm trying to say in terms of telemedicine.
Yeah.
You're having like the worst period pains and you just need a prescription for painkillers.
Yeah.
Go sit in line and wait in pain.
Because we're also doctors, so we know what we need.
Yes, there's that also.
So you think it could help communities that struggle with access to medicine?
Yeah, for sure. I think healthcare is one thing that's very scarce. Like it's. I wish it was more not even affordable, accessible than it currently is right now. So I hope that, if one person starts, everyone else will try to catch on and we'll see where it goes.
Do you think the older generations would be willing to adopt, or they want to see the doctor?
I think there might be some resistance.
We all like convenience.
Yeah.
Yeah.
Price of fuel is expensive, boss.
Absolutely.
No.
I think, so with my doctor, I have a GP and, she's family friend, so she's on my WhatsApp. So I think that's telemedicine.
It is.
Yeah. But
like, what would you ask her,
how do we create the boundary? So we'd have times maybe?
There's.
Okay.
So again, it's a work in progress. It's not necessarily an exact science that I have down to a T.
Because you have access.
Yeah, and I just put my phone on D&D though.
Okay. So you mentioned Dr. Google being one of the patient's favorite doctor.
Yep.
Is it helping or harming the healthcare system?
I don't know how I feel about questions that kind of, it's either yes or no.
Okay. What do you think about?
No. I like the question. What I'm saying is it may just become a bit monotonous in the sense that I'll probably give you both sides.
Which is fair. I think.
Yeah, I can't go out on a limb and say like, yeah, it's annoying. It's bad. For the most part, overall, there's no added benefit. But there has been a few cases where it's helped because there's something that you didn't even bother thinking of that a patient Googled and you're like, wait.
Oh, that's a possibility.
Like that could be something to investigate. I consider it more like a second opinion.
Yeah.
Besides, like, I don't take no disrespect to it. I don't feel... Most, if not some people, do feel offended that you decided to like...
Pre-diagnose.
And then come with that stuff here.
Yeah.
And kind of like try and convince me of what you saw. But I'm very diplomatic. Now after I tell you what I feel, I'll be like, you know what? At the end of the day though, it's your body.
Wow. Your body.
If you don't get better after 3 days,
yes,
I would just say go see someone else, because our conversations
have ended.
Yeah.
Yeah, but I think it's important for doctors to open up the conversation, because we have a lot of anxiety, and it's nice to go to a doctor who's willing to be like, but I think it might be this. Could it be this? Can we eliminate it so that I can sleep better at night? Because I think also Black communities are misdiagnosed a lot, and things are passed off as not important. Let's talk about men and health. Why are men so reluctant to go and see the doctor?
I don't know, eh?
And are they? Is it fair to say they are?
Yeah. I think that's something that I may need to look into. Just in the places where most people seek help, you find more women than men. Statistics show that more
Even
women
in
attend church than men do.
Yeah.
Clinic is easily 3-to-1 ratio, like 90 to 10. If that man's coming, and some of them openly tell me, I'm only here because my partner said I should come. Then my mom dragged me. Oh, what's wrong? No, I've been having this headache for how long? 3 months. No, I've just been taking Disprin and so forth. And I think that the annoying thing is, by the time you're coming in, it's become so progressive.
Yeah.
It's going to make all of our work harder. Because you see, if something's off with the woman, she's next day she's coming in. Oh, listen, yesterday this, and the third. Okay, we can quickly make this go away. But you're coming in and telling me this thing's been there for
stage 4.
Yeah. What must we can do now at this point?
But what do you think though? Like, so I have a friend who's a pharmacist, right? So she's like, if you have a headache, take painkillers. But our parents always encourage the body to heal itself, right?
Yes.
So I think sometimes we have a tendency to just feel like, no, we're gonna be fine. And so because sometimes you feel like over medicating, your body becomes dependent on the medication. So what do you think about that? Do you think that if I have period pain, I should take a painkiller, or do you think I should sometimes thug it out? Or
so are you asking me this question as...
It's not a follow-up.
No. Okay. Are you asking me this question as a doctor or as a general person of society?
As the doctor.
Because the reason I'm asking is that's my answer. That's what you should do.
You should take a painkiller.
No, have the conversation with your doctor.
Okay.
Like...
But doctors are also capitalists, like we said. So they're trying to bill.
I hear that. My Let's do this.
Okay.
Let's do this. We'll play a little game. A 25-year-old woman walked in this morning to see me. Her only symptom was that she was vomiting. Do you think she's pregnant, or do you think it's food poisoning?
I have to test her pregnancy.
Some more questions, right?
Yeah.
One thing can be explained by multiple. One is a reproductive issue. One is digestive. They have nothing to do with each other. So the issue here is that someone's in pain. How much pain? Like, if I stub my toe on the table, I'm taking painkillers. I'll jump around, hop around. But how many times do you take pain meds for like bumping the door? Almost never. But if you're like in debilitating pain, like your period pains are doing you in, then yeah. Because again, it becomes a thing of, when do we introduce the pain meds? When is it becoming dependency? Every little pain, you're taking pain meds? Yeah, no.
Okay. Let's go back to men and not going to the doctor.
Please stop that, man. This, my fellow gender, stop that. I'm looking straight into the camera. Stop it.
Yeah.
Go see
help.
the doctor. Yeah, it's okay.
You're
Doesn't
not
make you
supposed to be
less
in pain.
manly. Just go and ask. Half the time, it's not what you think it is. It's not that bad. Just go.
Just get the help.
Yeah.
Eliminate.
That's all.
Okay. No, that's